Hello, so today I'm doing the major report presentation on Staphylococcus aureus. So this is a little bit about the disease. So it is gram-positive. It's the cause for many diseases, some of which are cellulitis, impetigo, and food poisoning. Another strain of it is mrsa, which is it is multi-drug resistant. So this is methicillin-resistant Staphylococcus aureus. It is a very strong bacteria. So this bacteria can subside in extreme temperatures. This strain, the mrsa, it adapts to new medication. It is why it is so hard to find a cure for this. Scientists are still trying to find something that will help with this disease, but there are only a few medications that will work. Okay, so this is a little bit about where it lives. So it subsides on the nasal passages and in the mucosa. That's where it's most found. It can infect individuals through unhealthy and dry skin. So there's a normal flora living on the human skin and in the nasal passages, but it can infect someone when they usually have dry or cracked skin, and that bacteria can enter those cracks and enter the body. Um, so again, dry and cracked skin is not good, but healthy healthy skin is a great barrier to this bacteria. So if it enters the bloodstream, it is very dangerous. That's why it's important to treat the disease as quickly as possible. Um, it is spread through direct contact. Hygiene practices such as frequent hand washing and washing clothes are very important. And it needs to be emphasized in the healthcare setting because those who are immunocompromised, it can definitely result as a secondary infection. So this is a little bit about the disease. So this is its family and its phylum. They are in cocci shapes. They resemble grape clusters, is what this means. So the gram staining, they're gram positive, so they stain purple in the gram stain. To just determine all Staphylococcus species, a catalase positive test can be performed. Um, to determine Staphylococcus aureus from other Staphylococcus species, a coagulase positive test is needed. So this is about the antibiotic resistance. So the MEC gene, this gene is carried by MRSA strains on the chromosome, and this results in antibiotic resistance. So the MEC gene is encoded by the protein PVP/2A. This is a penicillin binding protein that causes peptidoglycan in the cell wall, and that results in synthesis of the cell wall under the stress of antibiotics. So some antibiotics that MRSA is resistant to is oxacillin, cephalosporins, and methicillin. So when penicillin first began to be used, it was effective against many bacteria and showed very promising results. But not long after its use, the first strain of penicillin-resistant Staphylococcus aureus was discovered because of the BLAS gene. And the BLAS gene is carried on transposons. So vancomycin served as a last chance for fighting, however the bacteria shows signs of resistance. Daptomycin is an accepted treatment. So this bacteria can subside in many different locations and areas. So its temperatures can range from 4 to 48 degrees Celsius. The pH is from 4.2 to 9.3, so a very wide range between the two. It can be found in many different areas. It can survive in dry environments with a high salt content. So this bacteria can withstand extreme dehydration. It is carried by workers into the food people consume, causing poison. However, most cases run their course and do not involve remedies. So the bacterium does not have a specific environment that is most common. However, it is seen being carried by humans, animals, and more. So they are located in many places, but many were found in large-scale animal breeding facilities. So this is about the strains of MRSA. So there are different ones. There are healthcare associated, there are livestock associated. Um, so these strains of MRSA promote infection in communities. So if they're livestock associated, they're usually asymptomatic in animals, and they're specifically asymptomatic in pigs. So these pigs receive this MRSA because of the humans that care for them. So the humans usually bring the MRSA in on their nasal passages. So the clonal complex CC398 is a strain of the livestock MRSA. So the growing trend of MRSA seems to be impacted by the size of farms, cleaning disinfectants, and components in the feed. This strain is very dangerous to those that are hospitalized and immunocompromised. So people who usually receive this type of MRSA from the livestock is usually hospitalized, and it can enter surgical wounds or surgeries or anything like that. It can be a secondary infection. So this is a picture I just put on here, and it kind of just shows how MRSA becomes resistant to these antibiotics. So mixed bacteria population infects person. So usually people who are infected with bacteria receive antibiotics. So these antibiotics kill non-resistant bacteria, but then resistant bacteria multiply. So usually people receive resistant bacteria because they do not finish their entire course of antibiotics. And if you do not complete your entire course of antibiotics, usually that's when bacterial resistance occurs. People will start to feel better and their symptoms will completely reside, but it does not mean you should not stop taking your antibiotics. So then the bacteria can be spread. So the resistant bacteria infect a new person, which then again take antibiotics, and the antibiotics fail to kill the resistant bacteria. So it starts off light, and then here in the end it's extremely resistant. So here are some signs and symptoms of MRSA. So they're usually brought into the nasal passages. You may see small bumps and boils, and this is usually followed by redness and fever. So they can become large abscesses under the skin, usually localized. However, if you do not treat them in time, they can enter the bloodstream and become fatal. So HIV is usually the primary infection, and MRSA usually can become a secondary infection to this condition. So if the infection is left untreated, these are some conditions that it can cause. So it can enter the vital organs, such as the brain, and cause meningitis. So some signs and symptoms of meningitis is stiff neck, headache, and a fever. So it can also lead to an abscess that is localized in the brain, which can lead to seizures and personality changes, which I thought was interesting. So your heart, if it enters the heart, it can lead to endocarditis. This is an infection of the heart chambers and valves. It's very dangerous. So some signs and symptoms of that would be like shortness of breath and murmurs they may occur. So if it enters the bloodstream, it's called sepsis. So some signs and symptoms would be fever and rapid heart rate. Those are usually common. So treatment, again, must be immediate. If you receive any signs and symptoms of MRSA, it needs to be checked out and treated immediately. So, treatment of this infection, if they are localized, if the infection is localized, it usually needs to be surgically drained with medical help. It needs to be an invasive procedure. So treatments are low, but there are still some remaining antibiotics to help. These include vancomycin and linezolid. So again, it is very important to take the full cycle of medication, so that way the resistance will not build any more than it is. So again, if you start feeling better and you feel like your symptom and infection is completely gone, you're wrong. The antibiotics needs its full course to completely rid the body of all those bacteria. So, how is it diagnosed? So, usually if symptoms are present, you can receive a skin biopsy, cultures on the drainage, and a blood culture can diagnose this infection. So, this infection, it can reside on medical equipment for a long amount of time. So it is very important for medical personnel to clean their instruments and especially if somebody leaves the room, a patient leaves the room, to completely wash the room and get it ready for the next person. So this is interesting. It is estimated that the infection has hospitalized over 100,000 people in the last year. Um, and bed linens also must be kept clean and dry because it usually is most commonly found in bed linens for hospitalized people and can really infect those people who are immunocompromised. So this is about the rate of infection. So this infection can lead to pneumonia, which increases the rate of hospitalized individuals. So the cases are continuing to grow, and it is found that it is more common in America than any other country. So it is a challenging process because people stop taking their course of antibiotics as prescribed. It is found mainly that American people, it's a trend that they usually stop taking their course of antibiotics. Um, and scientists are continually trying to find a new antibiotic, but by the time they do find one, it's already resistant to another. So it's a continuing cycle, and it is very hard to treat the infection. So about the cost of treatment, it's a lot of money to treat this infection. Um, the cost to treat MRSA is roughly around $8 billion in the world, which I thought was really interesting to note. Um, and so people who are infected with MRSA, um, it's an average that people who get MRSA in hospital settings can spend around $10,000 in medical bills. This is due to, I guess, the prevalence of the infection and the cost of a new antibiotic treatment and that kind of thing. It also is a long course of treatment. You have to see what works and what doesn't for each individual, so they can spend a long time in the hospital to make sure they're okay. So, because the bacteria changes often, it leads to delayed course of antibiotic treatment. So this is a picture of the bumps and boils that an individual usually will see in MRSA. They're rounded and they're usually superficial, but however they can lead to abscesses and usually they're painful and red, and usually you can see some swelling down in the extremity as well as redness. And late signs would be like fever. So this is just my works cited.